So, Mary, let's quickly start, if you don't mind, with what's new in your world. What are the new developments since the last time we talked?
Well, not a lot of new information in terms of guidelines or guidance. The last guidance we got from OSHA was from May 1st, so that's 2 weeks old now. The last guidance we got from the CDC is from April 27th, and I know that the ADA and a lot of groups are really pushing for the CDC to update their guidance because it only allows for emergency procedures. We don't have anything in place that says what we do when we see elective patients, although right now we're assuming that it's the same thing, following the same guidance for emergency procedures. But it's very frustrating. What I'm seeing a lot now that it really scares me is people trying to find ways to reuse the N95 masks, and they're buying devices, UV light wands, and other types of devices to decontaminate the masks that are not listed in the CDC guidance documents. There's a whole list of things that are allowed and not allowed in terms of reusing or decontaminating masks. And people are being told in webinars, put them in an autoclave, and they should not, because it compromises the mask. It makes it ineffective. They're being told to spray them with bleach. They're being told to spray them with disinfectant. And the minute you get that mask damp, you compromise the effectiveness of the mask. And now the big issue, because a lot of webinars are now talking about fogging dental operatories. And I think it's a bad idea right now. The products that they're talking about fogging with, hypochlorous acid, hydrogen peroxide, are the two key ones that are really not harmful substances in terms of a chemical hazard. But what we don't know is, what are those products ultimately going to do to our equipment? Is some of that mist going to get into the electronics in our units, our imaging systems? And if we do it in the sterilization room, is it going to be in the sterilizer? What is it going to do? And the other thing is that, yes, there are scientific studies, validated studies, that say that hydrogen peroxide and or hypochlorous acid will kill COVID. There are no validated studies. Well, let me take that back. There are validated studies that say that hydrogen peroxide and hydrochloric acid will kill Ebola virus and SARS virus, but we don't have validated studies yet that say it kills COVID-19. And we don't have validated studies that say it's appropriate or effective to use in a dental practice. So there's too many unknowns there to think about fogging, but some really great information is being researched right now about using this hypochlorous acid, because it breaks down into water and salt. And so two very innocuous substances. And it's also being researched to maybe, now please don't anybody go run out and do this because it's not FDA cleared yet, but perhaps being able to use it in our water bottles, and so that the aerosol might be less contaminated, perhaps using it as an irrigating solution. They're even talking about researching it as a nasal mist to treat COVID, but it's not FDA cleared. There aren't validated studies on it yet. So we have to stick to the science, and beyond the science, we have to stick to what's validated for use in dentistry and against COVID-19.